Good afternoon. Let's see if we can make that big so I can read it. Hi, my name is Dr. Lisa Warhuus. I'm here representing Alameda County Healthcare Services Agency. I am with the Office of the Agency Director, and I'm here to talk about how one strategy for the healthcare sector to collaborate effectively with school systems to address health and education outcomes. So I'm here to talk about the work that the Center for Healthy Schools and Communities within our agency does, that it really is just one example of how many other places in healthcare, public health, city public health systems can really work in a really collaborative way with school districts to have collective impact. We're here in Alameda County. We're in the largest populated city in Alameda County, Oakland right now, and just to set the context, we have a population of about 1.5 million, and we have 18 school districts. So the center that I direct works collaboratively with 18 districts to address health and education outcomes. Our vision is that we envision a county where all youth graduate from high school healthy and ready for college and career. Our health department, our healthcare services agency, several years ago, we have a long history of working collaboratively in education. And our basic premise is we're looking at the social determinants of health, and we know that education is a huge determinant, that if we can actually impact education outcomes, we are also impacting health outcomes. And so back in the 90s, our county made a deliberate, intentional effort to invest in school systems, and our Center for Healthy Schools and Communities grew from there. We have a results focus. We're our primary results are that children are physically, socially, and emotionally healthy, that they succeed academically, that environments are safe, supportive, and stable, that families are supported and supportive, and that systems are integrated and care is coordinated and equitable. So what do we do? So the Center for Healthy Schools and Communities has a staff of about 50 people that work directly at the school with school districts to build school health initiatives. Our primary role is to build capacity, fund school health, convene and broker partnerships, provide services, and influence policy. So what is a school health initiative? It's a collaborative approach for improving health and education outcomes for all students. They essentially consist of school-based and school-linked support systems to address barriers to learning and provide safe and supportive environments in school for students, families, and staff. A lot of school, county, city partnerships are a school-by-school kind of approach. And actually, when we started our work, we started delivering behavioral health services in specific schools. We built school health centers, which I'll say something about in a second, in specific schools. And then what happens? 5 years later, the principal leaves, and the new principal comes who's all about academics, and we don't need that health stuff, and our school is not, strong if we have health supports. We have learned over time that we actually have to support district capacity to support a health and wellness system for students. So one of our primary strategies has been to fund and or provide through our own staff district-level health and wellness consultants, full-time, who essentially oversee the health and wellness system in a district. That means that all the partners, all of the county efforts, all city efforts, all nonprofit efforts can flow through these district-level staff, and they actually can create a system-wide support system for the entire district that is sustained over time. So we fund, and these individuals, they really sit at the administrative level of the school district and are part of the administrative team. So they have the opportunity to educate, support, and address the entire system in understanding why health and wellness is important. We also have key program areas that we provide and our support. So we fund and support 28 full-service school health centers. I believe 9 of them are in middle schools, and they provide full medical services, mental health supports, youth development services, and sensitive services, which rate are different in middle school compared to high school. And maybe I'll get a question about that. We also fund behavioral health supports in over 200 schools, also at the district level. We support youth and family opportunity initiatives across the county. We actually oversee a large full-service youth center in the unincorporated area of Alameda County. And then we have support family resource centers across school districts. So we actually started in the school health center business. School health centers are, they're both health clinics, but they're also places for students to go to experience youth development opportunities, leadership opportunities, and we actually network all 28 of our school health centers in a learning community and have a really clear both service delivery model and a funding model that has allowed them to sustain themselves over time. Most of them, nearly all of them, but one I believe, are run by federally qualified health centers in partnership with the county. And we provide an annual funding source of about $120,000, and they are able to leverage upwards of $1 million through their various funding streams that are supported by the model. We also have a model for school-based behavioral health. And I want to say, when we talk about school-based behavioral health, we're not talking about putting mental health clinics in schools so that kids who decide they need services can get their 50-minute hour once a week, which was a model that people used in the past. School-based behavioral health for us is a 3-tiered approach. It's a public health approach where we really stress supporting school culture and climate through practices such as restorative practices, trauma-informed schools, mental health consultation with teachers, and really support schools in building climate initiatives that strengthen their ability to be good places for kids, where kids want to be, where families want to go and feel welcome. And for those who need additional supports, if it's mental health, whether it's group or it's check-in or building relationships with students, we'll have a 2nd tier. And we do also offer mental health, more treatment services for those students that need that. But we really want to emphasize that the school and the system needs to have an environment that supports positive youth experiences as opposed to contributing to mental health issues. And I always say that school-based behavioral health is way more about changing adult behavior than it is about youth behavior. Just to share our overall county commitment and investment, that number's gone up to about 17 million. We have a base funding of about 17 million annually, but through that we're able to leverage 52 million, and so we're actually pushing out $67 million of annual investments in our school districts. We use a results-based accountability framework, which our county uses in all of its evaluation, looking at their results. We have that framework, but just to share some of our outcomes, in 2018-2019, for example, we had 14,500 students registered school health center clients and made 56,762 visits. We also had almost 7,000 non-clinical county client contacts with our school health center, showing that kids aren't just going there for service, they're going there for relationships, for youth development opportunities, for information and that kind of things. Our district health and wellness consultants just last year spent 239 hours of training, did trainings in school districts around things like trauma-informed practices, restorative practices, mental health awareness, and 4,144 hours of mental health consultation with staff and parents and teachers. How well did we do it? Looking at our percentages, school staff, caregivers, youth, all feel like their experiences in our programming have been beneficial at very high levels. And then, is anyone better off as a result of what we're doing? And these are just examples of our data and ongoing how we look at how we're doing. 84% of school health center clients agree or strongly agree that the school health center helped them get healthy food when their families didn't have enough. We are moving into a world where now our health supports in schools are supporting food, trying to address food insecurity, homelessness, and that kind of thing. 41% of students receiving direct mental health supports showed improvement, and we are always working on improving that number. So that is just, as I said, one example of how a public sector can really work, how the health system, the city government, county government system can work collaboratively with the school system to actually create real change for students, for families, and for school staff. Thank you.
Now we're going to hear about the healthcare sector itself, and we're delighted to have as our speaker Dr. Tina Cheng, who's the Given Foundation Professor of Pediatrics and the Director of the Department of Pediatrics for the Johns Hopkins University School of Medicine. She has a joint appointment at the Bloomberg School of Public Health, and she's the pediatrician-in-chief of the Johns Hopkins Hospital and co-director of the Rails Center for the Integration of Health and Education at the Johns Hopkins University School of Medicine. Dr. Cheng.